Welcome back to Titan Mind for this special addendum episode 3.1. In our last episode, we mapped out the main toolkit for managing anxiety, covering everything from the daily SSRIs like Zoloft to as needed options like the beta blocker propanol. But there is one massive class of medications we purposely left out because it deserves its own spotlight: benzodiazepines, which includes well known names like Xanax, Valium, and Ativan. Dr. Kamal, for the everyday layperson watching, what exactly is the biological role of a benzodiazepine inside the brain software, and what specific acute conditions are they still used for today?
Thank you, Ali. I think benzodiazepines are a very important class of medication. They've been around for a very long period of time. But once again, I want to emphasize that these videos are for common knowledge. These are not professional advice. This is our opinion. You can further check references for validity of the information, and always talk to your doctor before taking any medication or making any changes in the dosage of medication. This series is mainly to facilitate better understanding of medical language and medical information for a layperson. So going back to benzodiazepines, they've been around more than 60, 70 years, I guess. I'm not sure exactly. The first one was invented in Austria, in Vienna, by Roche company, which was diazepam. And over a period of time, it became very popular, and it was one of the medications which was given freely, and people used to take it for a very prolonged period of time. It is still manufactured in different brands, different dosages, and it is still a very useful tool. As we were talking about anxiety, we talked about different grades of anxiety, anywhere from very mild to incapacitating, panic attacks. And in acute circumstances, benzodiazepines are a very useful medication because they act quickly and relieve the person from anxiety. In a lot of cases, if anxiety is severe, we would start benzodiazepine and at the same time start SSRIs. As we talked before, SSRIs take about 4 to 6 weeks, usually to be fully effective. It needs to build up. But the patient has to be relieved immediately, and they can't just wait for 4 to 6 weeks of time. So in that case, it's very helpful. Benzodiazepines, in my opinion, you will not find it in any literature, but I think I have used the word benzodiazepines are alcohol in pill form. Now, you would ask me, because benzodiazepines, they act on the same brain receptors where alcohol acts. And benzodiazepine is used very extensively for alcohol withdrawal cases. If somebody is withdrawing from alcohol, and there may be many different physiological symptoms, even including seizures or different other reactions, we give them benzodiazepine and titrate it slowly down. In a way, we are cheating the brain. The brain is still conceiving that it's receiving alcohol, but it is not alcohol, it is benzodiazepines. And then we slowly adjust those over a few days, slowly tapering it down and making the withdrawal from alcohol much smoother and without much complication. So it's a way of looking at things. Benzodiazepines, there is a broad class or group, and under benzodiazepine lies a number of medications. For example, diazepam, which is also called Valium. We have said before that most of the medications have two names. One is brand name and one is generic or chemical name, and therefore there is some confusion among people's mind. So Valium is diazepam, Xanax is alprazolam, clonazepam is also called Klonopin. There is another medicine which was very popular in old days, especially in people with abdominal problems, called chlordiazepoxide. And that's the brand name was Librium. So there are different types of medication. They are in the same group, but they are also classified as short acting and long acting. It depends how much it takes for them to be eliminated from the body. So short terms will get a quick buzz and reach a higher level shortly, but they are eliminated from the body shortly, such as Xanax. And therefore, they have a lot of addicting potential. And when we are trying to use benzodiazepine, we need to always choose long-acting benzodiazepines such as clonazepam or chlordiazepoxide, which would not give you the buzz, and the addiction potential is much less, and it is much easier to get them off completely. If someone decides, the patient or the doctor, that it is time to taper or take away the patient from this medicine, the withdrawal is much gradual. Therefore, as a standard practice, if someone needs long-term benzodiazepine treatment, then it is always better to start on long-term. And even if somebody has been started on short-term, such as Xanax, it is advisable to convert it into long-term, clonazepam. As I said, clonazepam has a much more addicting potential, and the patient like it because it will give them a quick relief, but we have to tell them that if you take the long-term medication, actually they will prevent the anxiety crisis from being built up. You may not even suffer or experience any high anxiety.
If we look back a few decades, benzodiazepines were prescribed incredibly commonly, almost like candy, for general stress and everyday worry. Yet today, there is a massive clinical trend among psychiatrists and physicians to heavily restrict their use, scale back refills, and favor other medications. What caused this major shift in modern medicine, and why is the psychiatric community so cautious about them now?
As I have emphasized before, that you have to tailor your treatment individually. And there are multiple factors applying on patient, applying on circumstances, which determines what medication would be the best one for that particular patient. You correctly said that benzodiazepines were prescribed very commonly, especially by family physicians and in rural areas. And they took them for 20 years or 30 years even. And there was no much concern. But one of the main concerning events which developed is the rise of narcotic use. So opioids or narcotics, they suppress your brain and they suppress breathing. So one of the concern was that a lot of people were on benzodiazepines. So if they were also treated with opioids, then it had addictive effect. It doubled the sedation, increasing the mortality rate. So it was a very big concern that we didn't want anybody to have respiratory suppression. It was also found that in elderly people especially, it may cause problems with their gait. There were people, especially much elderly, who were falling down and had problems in their gait and were suffering from fracture of hip or other bones. And it is a very big concern in elderly. If they suffer from hip fracture, their chances of recovery is much less and they suffer a lot. So it is very important to make the patients aware of the dangers such as addiction or such as the fear of fall, such as respiratory suppression, and doses should be accordingly adjusted. Now, in my practice, when I started practice, I saw a lot of people who were prescribed benzodiazepines by their previous physicians, and either those physicians they moved or they died, and the guy was taking it for a very long period of time and wouldn't understand that I have been taking it for 20 years. Why do you want to cut it down? Or there are some other providers who are very progressive and they want to cut it down suddenly. So I think, in my opinion, that's not a good policy. Patient should be explained everything. Everything should be done with mutual consent, and it should be gradual. If somebody is on benzodiazepine for 15 years, it's all right if it takes 6 months or a year to taper that person down or off completely. There is no emergency. So the taper should be very slow. Otherwise, they will have rebound anxiety or they may even experience seizures. But once you explain them, they are usually agreeable. Another point which I want to emphasize, that there is a certain class of patient which would need benzodiazepines. And that is why it is made. People may ask, if you don't want to prescribe it to anybody, why you are manufacturing it? Makes sense, right? Mm-hmm. So there are people who would benefit from it. You just have to be more aware of it and talk to the patient. They would understand your point of view. Whatever we are doing is in patient's best interest. And once you have their trust, it's much easier job. Some people, you may have to a little bit force them and tell them, look, I can't give you that high dose. If suddenly somebody shows with very high dose of benzodiazepine, which you think is not acceptable, I tell my patient, look, I'm not taking you off completely, but I can't prescribe in good faith what you are taking. So let's do it slowly.
We come to our final segment, Titan Habit, a positive takeaway. Dr. Kamal, thank you for providing such a clear essential boundary on a class of medicine that is so widely misunderstood. To wrap up today's addendum, let's leave our Titan Mind listeners with our signature practical positive tip. If someone is currently realizing they've been relying heavily on a short-term chemical emergency brake like a benzodiazepine to handle their daily stress, what is the best biological micro habit they can practice today to start building up their brain's own natural brakes?
It's a complex question. It could be different things from different people, but one has to live actively, one has to love life, one has to think positively. All the medications we talked about, they can be used alone or they can be used in combinations. Or, for example, we talked about propranolol. Propranolol can be taken every day as well. So some patients may be on benzodiazepam and they may not need it. They just have the satisfaction. They take it on as needed basis. When they feel very anxious, they will take it. There are some people whom you give just 15 pills and they would last 6 months. They would not even use it, but they have the satisfaction that they are in control. If any intense anxiety provoking situation arises, they can take it and be relaxed. Some people may just take it just before flying. So there are different combinations of medication. You can take it at different times, different ways. So there is no fixed rule. And again, I emphasize that each person is individual, each person is unique. We also talked about existential anxiety. But anxiety, as we talked before, is a natural psychological and physiological function of our body, and it is necessary for our survival. But excess of anything can be bad. But I think we have covered a lot of ground, and it will be helpful for people to understand where we are coming from. And as you mentioned before, we are always happy to answer any questions which may come out of these discussions. So I will stop here. Thank you for giving me this opportunity to put this video together. I hand over to you.
Beautifully said. Your lifestyle is your long-term software update. To everyone watching, this wraps up our complete look at anxiety, hardware, and software. We want to hear from you in the comments below. Has a doctor ever switched you from a fast-acting med to a daily maintenance plan? What was that transition like for you? Don't forget to like and subscribe and hit the bell icon for notifications, because in our next full episode, we're diving deep into massive global crisis, depression. We'll look at how it silently halts your daily functioning and will confront the hard realities of suicide risk. Take care of your mind, and we will see you next time on Titan Mind. Thank you.